great day salutes medical pioneer Dr. David Sabiston, an early innovator in cardiac surgery. In 1962, he performed what's considered the first coronary bypass surgery, using a vein from a patient's leg to bypass a blocked artery.
Welcome back to Great Day. We're all familiar with scarring, but for some people, the scars turn into keloids that look somewhat like small tumors. Cutting them off oftentimes means even more scarring. It has many people with keloids feeling helpless and hopeless. My next guest is pioneering a new way to treat keloids. Please welcome surgeon Dr. Canaan Harris. Also joining us is one of his success stories, Jaquetta Perry. Hi. First, explain what keloids are and why it happens.
Well, we actually don't know why it happens. We do know that there's a genetic predisposition for scar formation. There are certain ethnic groups, African Americans and people from the Mediterranean area, are the ones that usually develop keloid scars. And keloids come in various grades. You can have them mild keloids to very, very severe keloids, large keloids.
And they look almost like tumors.
They are tumors. It's just fibrotic tissue. It's just the body hasn't told the fibrotic producing portion of the healing wound when to stop making scar tissue. So it just continues to make, mounds and mounds of scar tissue.
Yeah, and it can happen with just something seemingly simple cut to the body. I know a lot of times young ladies find out when they get their ears pierced. And Jaquetta, you had, what was the first indication that you had a problem with the skin?
Well, it started off like a little chicken pop. And it was just like a little bump. And then my parents had took me to have surgery on it, and it just started growing and growing. So it was like really big. And then my ears was hurting a lot. And just all of a sudden, little bumps started coming up.
Yeah, and we're taking a look at that right there. And so had you gotten your ears pierced as a young girl?
Yes. I was like 14 when I got my ears pierced first.
And what happened when you got them pierced?
They were just hurting a lot, so I just took the earrings out. And this just started growing and scapping over, and the scar stitches just kept getting bigger.
Yeah, what did you think was happening?
I really didn't understand it, but I heard someone say it was keloid skin.
And so the tough part about that is dealing with it on obviously the medical side, but then the self-esteem side. Because medical side, they would say, well, there's nothing we can do about it at one time. And then self-esteem wise, do you have people stare? You have people ask questions?
They're like, what happened to your ear? Or, what's that?
Yeah.
But it was like really on my face, but it was so big, they thought it was on my ear.
Yeah, and we're looking at your face right now, and it's not that big keloid there.
No.
Now, oftentimes, again, if you want to try to remove them, the problem was they come back.
That's absolutely right.
Okay.
Yes.
So what is the difference this time? What have you come up with that makes a difference here?
Well, I've developed this combination of products, and some of it's chemical and some of other absorbable products that prolong the effects of the non-scar forming solution.
Wow.
And that is based on where you put the solution, but surgery, you still have to do no surgical technique and respect surgery in terms of how far you can go and what you can do for the patient. Using the solution has worked very, very well in a large area. The thing is that your patients don't have to have another surgery. They have to have no more injections, and radiation therapy, which is also the standard of care, has been part of it. Don't have to have that at all either.
Yeah. So exactly what did you do for Jaquetta?
Well, that's pretty much what I described. Is we surgically removed it, and then the solution that I have is called keloid, and we put that in a strategic location, trying to prevent more fibrotic tissue formation.
So this makes the surgical removal work. It's okay.
That's absolutely right. And then, of course, you close it based on surgical technique for that area.
Yeah. Did you think it was going to work?
No.
You see that look on her face? She went. I think I almost detected, wait a minute, I almost detected you do one of these things right here. Could get the camera over here, right? I detected one of those right there. Yeah, you didn't, because you had been disappointed so many times before. What other things had you tried? Or were you simply just told, sorry, can't do anything about it?
Yeah, once that doctor did that, it just grew back, and I always wore my hair down.
Yeah.
Never back, never nothing, just always down.
Wear your hair down and hope that you don't ever accidentally have a scar or cut, because then it would go crazy and be another keloid.
It'll grow again, any parts of the body.
Yeah.
So I was like, I don't want to get cut. Then I think about that with my kids.
Well, it's almost immediate results.
Well, for the most part, yes, it is. You know, I mean, certainly you have to really respect the healing process and follow the patient closely. And but I've had very, very good results. And this is my third year in going in and doing using this technique, and it's worked out very, very well.
How widespread is this?
It's pretty prominent. It's, I would say, about 1 to 5% of the African American population have a significant amount of keloid formation. Yeah. And most people go through the same thing that she talked about. They have surgery done, they have radiation, they have the injections, and they go back and forth, and they just get to a point where they says, look, I'm not going to have anything else done. And I've had patients that come in because of me doing this procedure and says, doctor, I don't want to have any more surgery because I'm just deathly afraid.
Right.
And I said, well, take a look at the pictures. He said, I don't care about the pictures. I'm just not going to have any surgery. And so what I'm trying to do now is to use it instead of the concentrated solution that I use now for the excision. I'm going to go ahead and dilute that down and start injections and see how that works out. So those patients who are really apprehensive about having surgery, at least have another way of, without them having to go through anything else.
With that said, is there a point someday where perhaps there's some kind of ointment or something that if you're somebody who keloids easily and you have a cut, that you put something on there right away so that it doesn't happen?
Well, I like to think so. You know, I think that, yes, I am hoping that I can go to the cutting edge of that.
Yeah, kind of like a Neosporin keloid control, you know? Okay, you just, keloid sporin or something like that.
Absolutely
yeah.
right.
Yeah. Now, let me just say, had you not thought about that, keep old Deborah in mind when the royalties start coming in. But, Dr. Canaan, thank you very much. I know this is really exciting news to so many different people. You're kind of in your honeymoon phase right now because you're able to do things like wear your earrings and the whole bit, and you just, I think somebody's calling you right now.
I hope so.
Needing some help. Okay. Okay, but thank you very much, because it looks like you're so happy. And you can put your best face forward and pull your hair back and show that beautiful smile. All right. Was that somebody going, hey, you on TV? Okay. Well, for more information, you can contact Dr. Harris at his office. The number is 713-658-1900, 713-658-1900. That number, is right there on our screen as well for you. Still ahead, a breakthrough when it comes to healthy hearts. It's a new kind of bread giving people new life. Meet the doctor who is serving it up next.